welcome to Health Impact Digital Health Talks. This is Megan Antonelli, and I am excited to be here today with Dr. Olga Kagan, founder of the Food Allergy Nursing Association and a distinguished nurse scientist, educator, and entrepreneur. Dr. Kagan brings a unique insight into how nursing leadership and technology are transforming food allergy care and patient outcomes. Hi, Olga. How are you today?
I'm good. Thank you for having me, Megan. I appreciate the invitation.
Yeah, well, it was such a pleasure to meet you at Health Impact in January. And, food allergies is it's such a big topic and such an area of interest for so many. Tell us a little about, your journey and, how you came to, sort of spark your passion for both nursing informatics and the food allergy challenge.
So I started becoming interested in nursing informatics when I worked at the World Trade Center program, which happened after 9/11. We got a grant, established the program, and part of the program was research. We had to collect data on a number of conditions that people were experiencing short-term and also watching them longitudinally over a period of time. And with just the sheer amount of data that we were collecting, to analyze would be a nightmare doing it by hand. So, of course, we looked at solutions like the electronic medical record. And so at first it was very basic, just the digital version of a paper chart. And then eventually, it got advanced. And now we definitely see more interoperability and whatnot. So, but that kind of sparked my interest in informatics. In terms of food allergies, as a nurse, as nurses, we always deal with allergies, not specifically to food allergies, but things like anaphylaxis, to latex, blood transfusions, medications, et cetera. And so this is something that we need to be familiar with so we can provide adequate care. But food allergies were not really something that were prevalent back at the time when I was a brand new nurse, and certainly something that evolved and became it has become a prevalent problem, chronic condition that we're seeing today. Mm-hmm. And so that's sort of like where I started with two of those things that I'm very passionate about currently.
Yeah, no, it's amazing to think. I mean, I try, 9/11, it doesn't seem like it was that long ago, right? That we didn't have electronic health records then, but we didn't, there's been such we talk about how slow healthcare moves, but in reality, now, I guess 15 years later, we are looking at certainly having a lot of access to those data points. And I think you talked a little bit about, kind of the allergy and how food allergies weren't something that we were aware of. I imagine they did exist, but they've been exacerbated by both our environment. And then of course we have food sensitivity and around that, and that there's a difference. Tell me a little bit, like, is it a metabolic physiological response? What's what do you think has changed in that we have a greater awareness of it now, but also in terms of just the physiology behind that to help our audience understand?
Yeah, absolutely. So food allergies is an Ig-mediated response, which is different from sensitivities. Like one example is on people, let's say, lactose intolerant. So when they drink milk, they're really, the problem is not being able to digest the sugar versus an allergic reaction, which is Ig-mediated reaction, which is an allergic reaction that could potentially lead to a fatal outcome if not treated properly. I know at the moment, the only line of treatment that we have is epinephrine, emergency epinephrine. And nowadays we've got more than one option, which is nice for the consumer because they now have options of injectable epinephrine and also brand new that just came onto the market. That's a nasal spray. So that's exciting for food allergic community to have access to different.
Yeah. Well, and it's so, I know me also as a mom, when my kids were young, and actually they're 6 years apart, my two boys, and my first, it was, maybe there was occasionally there was a kid with peanut sensitivity in the class. And so you had to be careful or there were no peanuts allowed. But then by the time Owen was in school, there were never any peanuts allowed, which is also interesting because in California, it's less so. He brings a peanut butter and jelly sandwich to school every day. But in New York, it was always very sensitive in the public schools, and you weren't allowed to bring any nuts back then. So I don't know if it's still the same. But you mentioned, so as a mother and a nurse, of course, that is something that made you very aware of the issue of food allergies. Tell us a little bit. We like to focus on sort of the founder stories of the women we interview. Tell us a little bit about what inspired you to found the Food Allergy Nursing Association.
Thank you. So yes, as a mother, I had two children, and actually my life sort of changed as a result of becoming a mother to two children who had food allergies. And being a nurse and, dealing with anaphylaxis in my professional life, then kind of prompted me to learn more about food allergies, because that's one area that in school, as a nursing school, we covered almost nothing. It was maybe a minute or two. We kind of said it in passing that you could be allergic to all those things, foods as being one of them, and that was it. And curriculum hasn't really changed much when it comes to food allergies, even though it's an emerging health problem with 33 million Americans having food allergies and 220 million worldwide. The current nursing curriculum hasn't reflected that in their updates. And so I think it's important that we cultivate a more food allergy informed nursing workforce so they could provide allergy competent care when they provide care at the bedside or a clinic setting, anywhere throughout the continuum where patients interface with health system. And so to do that, I said, so we have to find a way where we can have an organization where we can bring together nurses who share, say, similar passion and interest. And that's one of the pillars for our Food Allergy Nursing Association today, is to cultivate a more allergy-informed nursing workforce. Another pillar that we have in our organization is innovation and collaboration, because as an innovator, something that I actually been doing for as long as I can remember, except I never called myself an innovator until recently. Because as nurses, I feel like we always figure out workarounds, but we don't think of them as being innovative. But now that we know what it is and we can claim it, we can say that we certainly are innovators. And one of the things that came out in terms of this innovation within allergy space is, because of the technology we have at our fingertips, we can deliver care to populations that were historically marginalized and had access issues. So now we can use telenursing, and we can develop new models of care. For example, developing an allergy nurse educator role that could potentially be the person who can be an extension of the allergist or a provider to provide care in areas that are not easily accessible to specialty care. And we have a lot of those deserts, right? So where people can't travel, there's only maybe one allergist that is within 4-hour drive. We had this actually upstate New York. We have a family that the closest allergist is within 4-hour drive. And so also wait times, to see a specialist, it sometimes takes 6 to 9 months to even get an appointment. And so to alleviate some of those problems in healthcare, I think we could definitely harness technology and nurses that could help bridge the gap, deliver education, deliver whatever it is that we can delegate to nurses before the providers can perhaps see those individuals for a more specialized care, and then outsource some of the education and some of the other follow-up things to nurses. So This is something that been on my mind, and I know I'm not the only one. There are a number of us who've been thinking along the same lines, and so that's one other pillar within our organization that we're trying to support, is those development of those models of care, alternative models of care to help people with food allergies. And the third one is nurse-led research. That's something that's been also very interesting to look at. We've done, actually, we're conducting an integrative review now to see how much has been published by nurses, what type of research has been published in that space. And we're not finding a lot. And it would really be important that nurses are involved in research in that space and build body of evidence. So
I imagine, when you think about, I know many friends who have waited long waits to get in with an allergist, right? It is there's not many of them. They're highly specialized, and there's a huge demand. And then, of course, what happens is you end up in the ER with nurses who aren't, as you said, that the training has not been, where it needs to be on this. So the nurses, as they are with everything, but particularly this, are the front line in terms of dealing with, folks who are emergent in this. As you look at, and your journey it just makes sense, right? You were in this environment where there were so many points of, doing the research on 9/11, where you were looking at, various, some people with sensitivities, others with more chronic ailments that came out of that. But, doing that in kind of a paper-based environment, and then seeing how once we had the electronic health record, which is nice to hear, right? It's nice to hear the positive, right? Having the electronic health record does enable great research, right? And so having those points of data to see that, and when you get into more specialty care and more highly specialized, challenges for patients, that we can use that. So tell me a little bit about, when you think of not just the innovation, but the technology around informatics, like what empowers the ability to start looking at food allergies and how they're impacting, patients.
Well, in relation to food allergies, I think one of the technologies that we definitely could utilize is the remote technologies. So like virtual nursing, things that are, we can utilize wearable devices. There are just so many nowadays. And with the integration of artificial intelligence, so there's a potential for many clinical decision support type of tools that could be employed. I know we're far from this right now, still in that specialty, but I think there is a great potential. It's just a matter of really bringing the right people to the table and understanding, okay, where the needs are. And actually, in that vein, I'm going to California in a few weeks. We're going to have a session at the American Academy of Allergy, Asthma, Immunology / World Allergy Congress meeting. And that session is an innovation sprint where we are going to bring a small group of people, about 40 people or so, and they're going to break out into small groups. And we are going to try to look to see what some of the challenges are in that allergy space, and then try to solve for those challenges. I know it's going to be a mini session, only, less than 2 hours, but, we got to start someplace. And I think that would be a great idea of having diverse stakeholders who attend this conference to come together and think of what are the pressing challenges and how can we address those challenges. And, being a nurse on the team really is promising for me to know that more nurses hopefully will join, and we can work together with physicians and vendors and, industry on solving challenges.
Yeah, no, I know you've been involved in a lot of the hackathons and the MIT hackathon. I think I read in your bio, and that, and back to your point around nurse-led innovation, again, at the front lines of what's happening in healthcare, really to understand, where those problems are. And, so that's what I think, watching your journey in terms of what you've done, you really found a gap, and now you're meeting it both with the association, and then of course what the association can bring through education and training, and then by bringing those folks together to further innovate, which is awesome. To talk a little bit about, because I'm just curious. Actually, my older son had what was a gastro problem, but we thought it was allergies. We didn't know what it was, so we went through a lot of diagnosis for a long time. But again, went to a gastroenterologist instead of what ultimately ended up being a urology problem. But it was such a long diagnosis, and probably a nurse on the front lines would sort of caught it. But because we were sort of in this high level specialty care, we didn't catch the challenges, and we thought it was allergies for years. But in thinking about, that diagnosis, the diagnosis challenge that is the American healthcare system in general, because it tends to be so highly specialized, but then also that there's a definite proliferation of allergies right now. So sometimes you're like, oh, it must be. What's your, when you look at kind of where we are in society, of why there's more. I mean, one, sometimes awareness allows for that, but what's your thinking as an expert in this?
Well, I'll be honest, right now we don't really know the cause, right? So there are multiple theories, one of them being hygiene theory, we're living too clean, etc. But what I am finding is that definitely there are newer conditions that are emerging as people, becoming more sensitive. And again, we don't know if it has to do with climate change. It has to do with all of the things that in our food chain, that we just we really don't have one particular cause at the moment that we can pinpoint to. Otherwise, it would have been easy. We could have just eliminated it and then get rid of this issue, right? Unfortunately, not yet. I know researchers are hard at work trying to figure it out, and there's definitely connection with the immune system and the gut. So for sure, gastrointestinal component plays a huge role in our immune response. So the research has looked at all kinds of things like, parasites, and so a lot has to do with microbiome. And then there's actually a number of researchers and some studies that are being funded to look at that. And the conference that I'm going to, I'm really hoping to learn more about some of the newer research that's coming out. Because every year there's something new that we're learning. Like, for example, we're learning that, as you know, science is always changing, that in the past, avoidance was the strategy from having an allergic reaction. Now, the school of thought has changed because more research came out and saying early introduction is actually the solution. Instead of avoiding, we really need to introduce those allergenic foods early in life, things like peanuts, for instance, right? So this way, children can develop immunity to the product. And not avoid it, because we found that avoiding it actually made us more sensitive. And so science changes, and then we follow the science. And so in this case, we learned it from our researchers out of the UK. They had a study. They looked at Israeli children who ate bamba, which is like a peanut snack, and who lived in the UK, and those also who lived in Israel. And so they were able to find that those who were introduced bamba early in life, which they do in Israel, they had less food allergies than those who lived in the Western countries or in Europe at the time. So it was just interesting to see how research really helps us understand the future direction and how we can benefit our population that is suffering with that condition.
Which really comes back to that, the informatics piece of that, right? And being able to have all of that data, to look across all of those points of information, in terms of, I remember, and I think, I don't know anymore because it's been so long, but you're not supposed to give your peanuts for a long time. I think, strawberries were always something that was like a little, sensitivity. So you'd wait until the baby was 2 or something. So it is interesting. And of course that is science. That's the nature of research and learning, is that we follow, what science happens. And sometimes there's going to be, mistakes and errors. And then we go back and do the right thing. And that's, what's so important about having folks like you kind of, watching and seeing and doing that research. So you have this conference coming up in San Diego. Tell me about sort of where the association is in terms of membership. Do you guys do an annual event? How is it growing? How are you getting the word out? Tell me a little bit about where that is.
I'd love to. So we started in 2019. I thought about it and I said, okay, there's all this knowledge gap, and there's so many things. There's so much need, and I started talking to a couple of colleagues who had similar passions. And so we decided that we're going to convene a small group of nurses, which we did with shared interest. And then slowly we, worked on different projects. And then in 2022, we published an article with our vision of developing an allergy nurse educator role. And all of a sudden people were emailing, asking, oh, how can I get involved? And, can we be part of this organization? So we made a decision to open it up to other nurses. And then within 2 years, we had close to 100 members. And I said, it's interesting now that we have all these nurses, like, what do we do? Like, there's definitely interest. There's definitely individuals who are passionate and share our vision. And that's how we decided to incorporate and establish this non-for-profit Food Allergy Nursing Association in 2015. 2024, literally like couple of months ago. And while we weren't incorporated for a few years, we still run it like an organization. We had committees, we had speakers, we had all those things that we kind of did as a labor of love. And then now we're still doing it as a labor of love, but now we have more structure. Obviously, now we have paid membership because we need some revenue to offset some of our administrative costs. How it is with the website and attorneys and accountants and all the things that you need, and insurance, et cetera. So all those things that come with running an organization. And it's like building a business, which we are hard at work at, building the website and trying to build our membership and looking to solicit donors because, our membership fees are very, very, low, just so we can make sure that nurses can afford to be part of our community. We still continue providing speaker series on different topics within food allergies. We bring different experts. They are not always nurses. Sometimes they're physicians, allergists, mental health professionals, because, psychosocial component is a big part of food allergy management. The registered dietitians, social workers. I mean, anybody who touches a patient, because as you were mentioning earlier, the care has gotten so fragmented and so specialized that very few people are looking at the whole person. And so as nurses, we are trained to look at the whole person, from the time they, are born to the time that they enter healthcare system, to the time they enter school, to the time they enter, camp, extracurricular activities, wherever they go, we have to make sure that they are taken care of, that they know how to manage their food allergies, no matter what situation they're in, what setting they're in, whether they're in school or whether they're in play dates or birthday parties. We want to make sure that parents are well versed how to read labels, how to, navigate social situations, things of that nature.
Is part of your mission to get it to be part of the curriculum, like in terms of the nursing education?
Yes. So within our organization, our mission is really focused on promoting education, leadership, research, and collaboration. And we are definitely looking at those three pillars that I mentioned before. One of our pillars is a research, which, developing nurse-led research in that space and building body of evidence. Another pillar is innovation, which is developing newer models of care and collaborating with other professionals to do so. And things like allergy nurse educator role, for example, that could be delivered remotely or in a shared capacity between providers. And then lastly is education, because we do want to cultivate a more allergy-informed nursing workforce.
Yeah. And especially in such a rapid evolving, research space, to have that, education, one, be part of, obviously the institutionalized academic part of it, but that virtual educator also, because you can adapt that to whatever the most current research is. So that makes total sense. So you talked a lot about, kind of the tools and the applications of virtual nursing and how that can help with that, making those available and obviously increasing the access to that information and that education. Are there other areas that you're super, sort of excited about in terms of the emerging trends around healthcare technology?
Yes. So as I mentioned, telenursing or, virtual nursing, using wearable technology. So these are all great things that we could potentially tap into. But what I'm also excited about is my work that we do with HIMSS, Health Information Management System Society, because in my, wearing my informatics hat, we are really trying very hard to bring all different stakeholders together to solve healthcare challenges. As I said before, it's all about holistic view. It's not just about a vendor or about a provider or about, the payer. It's all of us working together. And I think that's how we're going to improve our healthcare system. So one of the things we're actually doing this year at the HIMSS conference, which this year happened to very much overlap with the other conference that I'm going to in California. So I'll be hopping from one to the next. And we are launching our first Nurse Hack for Health Techathon at HIMSS And we're very excited about that. We're going to be bringing about 120 individuals together. They're going to work in small groups. It's sort of like a mini hackathon. They're going to be working in small groups on different problems within healthcare industry. And we are hoping that we'll bring together not just nurses, but physicians, payers, employers from all different sectors.
What day is that at HIMSS?
It's going to be on Thursday, March 6th, and it's going to be from 8:30 to 12, I believe. So,
fantastic. Well, that'll be great. And, San Diego to Las Vegas, it's not so
bad.
cool.
Yeah, not bad.
Just have to spend some time on the West Coast. Well, we like to ask our guests often, sort of, if you think of one challenge, that you want to kind of solve using technology, is there something that really just, whether it's as a nurse or as a food allergy nurse, that, you think is the biggest problem that we've just got to tackle?
Well, I guess given my current focus on food allergies and technology, I think my biggest focus would be to really look at a food allergy specialty and make sure that nurses are available and are able to be part of care in a efficient manner using technology. Because to me, we've got nurses, we've got the expertise, we've got the technology. And I think it's just a matter of marrying those two together. And it's been done in other areas. Why not do it in allergy care and really help our patients access care quickly, at the lower cost, they don't require commute. I just feel there's just so many benefits.
Absolutely.
And we just have to make it happen, which I know requires a lot, but, especially from the financial standpoint. And logistics.
Well, share with our audience how they can get involved, either, by becoming a member or reaching out to you and hopefully supporting the Food Allergy Nursing Association.
Well, I am on LinkedIn, Olga Kagan. Of course, Food Allergy Nursing Association is also on LinkedIn. We're also on Instagram and Facebook. We have a website, www.foodallergynursing.org. And we're welcoming any nurse. Actually, our membership consists of nurses who are expert nurses, to novice nurses, to who are in food allergy space, and also nurses who are just interested in learning more. And as well as healthcare professionals who are nurse allies. We even have a FANA club that we're trying to build. And this is for donors who want to help us put our mission and vision to life. And so if you're interested, we'd love to have you, and grateful for any support that you can provide.
Oh, perfect. Well, thank you so much, Olga. It was a pleasure talking to you. And, I'm so glad I got to know you at HealthIMPACT this month. And, for the work that you're doing, because it's just so important, and to give both nurses and obviously patients the access to that specialty care that they need. So thanks so much for joining us. Thank you to our listeners today on Digital Health Talks. And, I hope you enjoyed Dr. Kagan's insights and highlights into this, incredible, potential for, sort of this nurse-led innovation to transforming specialty care. And to learn more, as Olga shared, about FANA's mission and get involved, you can visit foodallergynursing.org. And, for more innovative perspectives on health technology, subscribe and follow us at Digital Health Talks. Thanks, everyone. Thank you, Olga.
Thank you.